Are you totally confused as to what exercises you should be doing after breast cancer surgery? Stay tuned because I've got you covered. I have a 5-level step-by-step program that's going to take you from the day after surgery all the way through to full range of motion. Hi, I'm Marian Barnett, Cancer Movement Therapist, and what I have developed based on my 25 plus years of movement therapy is a 5-level program that helps breast cancer patients recover after surgery. There is a lot of information out there. If you look on the website and you look at the pamphlets that the hospitals are handing out, if you watch the videos online, you will see a variety of exercises. But the problem is, you don't know when to do them. Your surgeon may tell you that you can start with exercises 24 hours after surgery. You may have a surgeon that tells you, hey, you can start with active range of motion after we remove the drains. You can have a surgeon tell you, take it easy and just do what doesn't hurt. What does it tell you? You have no idea. So, what you need to know are some fundamentals, and what you need to know is what are the starting exercises and then how to progress through each stage, because that's the whole point. You want to progress, you want to get better, you want to know where to start, where it's safe and secure, and then you want to know how to level up. And that's what my 5-level program does. It takes you step by step. And what I do is integrate the exercises, starting where you can, right after surgery. And as you progress and as you get that information, whether it is you can do active movement, your drains are removed, you've met the criteria for the next level, all of these will tell you so you know and you feel secure that you can go to the next level. And that's what it's all about, is making sure that you feel safe, making sure you progress, and making sure that you are going to meet the goals that you've set for yourself. Because the whole thing is you want to get back to those activities that you love. You've gone through surgery and it has been a trauma to your body. You've had a diagnosis that's been a trauma to you mentally and emotionally. So we want to get you moving, because that movement is going to give you the empowerment to keep going through treatment, getting things back in gear, getting back to where you want to be. So we need to start small. We need to start where you're at, your age, the type of surgery, your fitness level beforehand. All of these things will make a difference as to how you're recovering. But the body recovers in the same way for everyone. It just does it faster or slower, and how you progress with your program should be the same way. But we know you always start with mobility. Mobility is key. You have to start with movement. We are not going to a strengthening program right away. We are not looking to stabilize the shoulders or the upper back right away. We need to get the movement back in those shoulders. And that is my 5-level program. Starting at the bottom, working your way up, seeing the progression is going to be amazing. You will feel empowered to keep moving. But you got to start somewhere, and you've got to feel secure with where you're starting. You want to have the security in a program that understands cancer, that understands the physiology of the body, and that understands movement. That's what you need to follow. So I'm going to go through one of the exercises. Actually, you know what? I'm going to go through 3 of the exercises that you can do in level 1. Now again, everyone's surgery is different. So this is getting the okay from your surgeon to be able to start with the level 1 exercises. I have a freebie that's going to help you when you go in for surgery, post-surgery, that your oncologist, your surgeon can look at and check off exactly what level you're at, where you can start, whether it be after drains are removed, after your next checkup. This is going to, again, give you that peace of mind that you need at this time to know what you're doing and where you're going. You need to have the strategy in place. You're yearning for some control over what you can and can't do. So when you're ready, and again, physically, mentally, emotionally, This is a package. You need to feel all of those to be able to move forward. But when you're ready, level 1 is where you start. This is important. Why? Because there's going to be swelling after surgery. Swelling occurs in any part of our body when there is a trauma. So whether it be something where skin has a laceration or a cut, which is happening during surgery, when tissue is damaged, which is going to happen during surgery, you will have swelling. That's the body's natural defense against trauma, and it's how things heal. We need to get rid of the swelling, and the best way to get rid of swelling is movement. So, nothing wrong with your hands, your wrists, your elbow. Let's go. Let's get the swelling down. Let's get things moving. It'll help feel way better. So, we're going to start with the fingers, and all we're going to do is make our fists and come back out, and make our fists and come back out. But this is where my levels may be different than what you see in the pamphlets, may be different than other things you've seen online, because I want you to move well. I don't want you to sit like this. I don't want you to just squeeze your hands. I want you to make sure you're doing it well. So when you see this, you see that the wrist is straight. You see that the fingers are coming down and coming back up. You are showing your body control. You are making those muscles work in a particular way, and that's what's important. Not this. We don't know what this means. But when we tell the fingers to extend and we tell the fingers to flex, we tell the wrist to stay neutral, we are doing so much more than just pumping out that fluid. This is control. This is using those muscles. This is getting things going the way they need to move. Same thing with your wrist. I want you to move well. You may not be able to do that right now, and that's fine, but that's the goal. I want the wrist to be neutral, and I want you to see if you can get that to a neutral position. If you can't, that's where you're starting. That's what level 1 is all about, getting all the fundamental pieces in place, so when you go to work on the things that are hard, you'll be ready for it. I don't want you to have finger issues, wrist issues, and elbow issues that are going to impede you from doing great rehab on your shoulders. So we're starting here. It's something that you can do right away, and it's something that's going to be of benefit. So let's look back at the wrist. Can we get the wrist to a neutral position? And can you see this? I don't know if you can. So I want you to be able to bend that wrist with the fingers staying neutral. We're just dealing with the wrist. Can we extend the wrist? Again, I want to see that control. I don't want to see this back and forth. No, number one, you can see if I'm flopping, I may be integrating other joints in place. I don't want you to do that. I want you to learn how to move well and how to control the body. This is important for any number of things and vitally important for your rehab. We want to get you back to what you love as quickly as you can. So control the movement. Control that wrist. Can you do this? When you come down, can you keep the fingers neutral? Or are they bending? When you come back, do those fingers spread apart? Can they hold that position? That's what you can work on. It also keeps your mind active on something that you can A, control, you can progress, you can get better at, and that's so positive. You need those positives right now. So let's work on that. So that's with the wrist. The next part that we're going to work on is the elbow. Simple. All we're going to do is the flexion and extension. Now I'm showing you out to the side. This is not where you're going to be doing it. Your arm's not moving out here right now, but I need you to see what's bending. And it's just the elbow. So that elbow is bending. My wrist is not bending. My fingers aren't bending. I'm bending the elbow. I'm flexing it and I'm extending it. I'm seeing if I can keep the wrist straight and the finger straight. So you can see the progression. You can see how we're building. Start with the fingers, go to the wrist, go to the elbow. These are things you can do daily. These are things that are going to have no effect on the surgery per se. What they're going to have effect on is it's your ability to heal and heal faster. And that's what I want for you. So let's review these again. We've got the finger exercises where we're working on keeping that neutral wrist. We have got the wrist flexion and extension where we're keeping the fingers neutral and together. And we've got the elbow flexion and extension where we're keeping the wrist and the fingers straight. That's your start. This is level 1. So let's recap level 1. Level 1 is movement of any body part other than that affected by surgery. So if you have breast cancer surgery and your surgeon says that you are fine to move your fingers, your wrists, your elbows, you are set with level 1. We'll go through level 1 exercises for the neck in another session. So if you have any questions at all, if you have any comments, I would love to hear from you. Send me an email at info@marianbarnick.com. You can DM me on Instagram or Facebook. I would love to hear from you. I would love your input, and I'm happy to help. Have a great day.